spring into considering to spay, neuter your pet. Spring has finally arrived in central Indiana. The smell of flowers and the chirping of birds at dawn has made getting up early more bearable. The importance of pet care is a lot like this in that most of the time it's a routine that pet owners fall into with some responsibilities being better than others. The easy ones are things like feeding at regular intervals, interacting regularly, flea and tick prevention, heartworm preventative usage in dogs, and routine veterinary visits. A more difficult decision is a concern of if and when to have your pet spayed or neutered. Recently, this topic has been debated in the veterinary community as well. Standardly, it has been related to pet owners that we should spay female dogs before their first heat cycle. A routine spay involves the surgical removal of the ovaries and uterus. This is routinely done at 16 to 24 weeks of age in dogs, but can be done earlier. The first heat in canines is usually at 9 to 12 months of age. Male dogs are routinely neutered at a similar age. This procedure involves surgical removal of both testicles. To stay up to date with latest top stories, make sure to subscribe to this YouTube channel by clicking the button above this video. The given reasons to spay younger female dogs are many. The first is that mammary tumor incidence in these spayed females is reduced to almost nothing. The incidences of ovarian, uterine, cervical problems also are drastically diminished. There are also problems, especially in larger breeds, of the bloody discharge that occurs with the heat cycle of dogs. Behavioral issues in certain breeds, including aggression, destruction and dominance, are also lessened. Unwanted litters due to unwanted breeding is also a main topic of concern. In male dogs, mostly dominant and aggressive behavioral issues and concerns are given reasons to neuter at an early age. In the case of male dogs, these behavior issues will start to occur when getting close to adulthood, usually 6 to 8 months of age in most breeds, and become habits. Marking behaviors and aggression or dominance are the main concerns here. If the habit is not desired by the owner, it would likely involve training to try to eliminate the issue. Another reason given is to try to keep the number of unwanted litters to a minimum in free-roaming dogs. This is in response to the continuous pet overpopulation issue that is a problem in several areas of the country. Medically, testicle problems are literally gone in a neutered male dog. Prostate issues in non-neutered males are greatly increased as well. Finally, a certain type of tumor that happens around the rectum of dogs is also greatly reduced due to lack of testosterone. There is now a question of these spayed or neutered dogs having problems of not reaching optimum size and weight due to hormonal losses. Another concern is that of urinary incontinence issues in middle-aged to older spayed female dogs, also due to hormonal issues. These reasons are somewhat controversial and are based on newer studies. Studies are still ongoing in several areas in order to try to give veterinarians and pet owners clarity and direction in these concerns. Personally, I believe that, unless one wants to be a responsible breeder and commit to the proper process, then spay or neuter your pet at some juncture. Secondly, I still feel very comfortable with the ability for younger animals to withstand surgery better than older ones, as they appear to recover quicker. It's also an easier procedure for the veterinary surgeon to spay a smaller, leaner dog than a larger, fattier one. The ultimate decision of if and when to spay or neuter your dog, however, is always entirely up to the pet owner.